Any questions?
Governor, you talk a lot about vaccinations, we talk a lot about masking here locally. Not as much about testing though. Can you just talk a little bit about your thoughts, the state's thoughts on at-home testing in particular and the availability of testing to consumers?
We have been ordering tests from the over the past few weeks in particular. We just had an arrival of 1 million testing kits. We have another million coming next week and another million coming the week after that. And I'm putting an even larger order in. So we're going to make sure we have what we need. What we're doing is getting them, first of all, out to healthcare facilities. So if someone's discharged, they can make sure that they can retest to make sure they're safe at home. Getting the local health departments a supply. I just think 3,200 arriving today.
That's correct.
All right, it might be on Santa's sleigh out there, I'm not sure, but there's 3,200 coming to even this small county. So we are getting them out to local health departments, working with our counties, making sure it's available. But some counties are even dropping them off in libraries, and we want to get them in schools. My goal is to make sure that when kids return to school on January 3rd, that they can stay in school if they test negative, and we'll get those testing kits to the parents. So a lot of workplaces also make them available. My number one job is to make sure there's ample supply of those at-home tests as well as the PCR tests. Also embedding more of our testing into our existing vaccination sites so they can have a dual purpose. We have some that are already doing that. I want to ramp that up as well. So when people are not feeling well, they don't have to be scouring their community trying to get a testing kit or find a facility that'll test them. So yes, testing is a high priority because what we anticipate, more and more people are going to be testing positive from this. We want them to, even if they're testing at home, just stay home. Do not go out. Don't go to work. Don't go see your family. That's how we can start isolating the spread. And it does not have to be long term. It's a shorter time frame. Find out that whether or not you're positive, get another test to find out you're negative, and then you can resume your normal activities.
Governor, with the Omicron variant now spreading throughout the country, and obviously Delta is still a big problem, do you expect to see more mandates on the horizon, and particularly a vaccine mandate for schools? Is that coming?
Vaccine mandates in the way New York state law is, it has to be approved by the state legislature, and they've not approved this particular vaccine. They have a long list of vaccines that are required in order to go to school, and I think that's a good reminder to all the parents. Your children are already vaccinated, or they would not be in school in the first place. So this is a routine function, making sure that your children will not ever contract diseases like polio that killed so many thousands of Americans. I know we don't need to talk about it now because a vaccine is so routine. We will get to that point, but other steps have to be taken. But my number one priority with respect to children is to allow them to stay in school. We saw an experiment, and God bless the teachers who were trying to teach children remotely, and all the parents who were trying to be the at-home teachers at the kitchen table. We saw huge disparities. Areas like Wyoming County, where there's rural poor, not everyone could afford to have the broadband. Not everybody has an iPad. So it was an attempt to make the best of a very bad situation, but we don't have to do that again. We can make sure that we're encouraging everybody to get their children and grandchildren vaccinated so they're safe when they go back, but also so in case there is a case in a classroom, we can give parents testing kits so they can stay in school unless they test positive. That's our objective, to change the whole model of, instead of immediately people rushing home, it is stay in school, stay learning, and stay in a nurturing environment, because that's what we missed for a long time.
We have time for one more then.
Perhaps
Up here.
I just wanted to mention, you mentioned that the COVID rate is high here, and I wondered if you could correlate that to the vaccination rate that's currently here, and are you attributing that to a low vaccination rate, or just people not getting the booster, or what do you think?
I have the numbers on our vaccination rate here, and it's not outstanding. We can do a little bit better here. I think it's right now our county fully vaxxed rate is 56%. That's a vulnerability. That is a high vulnerability, and that is not even including all those who are boosted. So I know that statewide we are considerably higher than that, and I believe that'll make a difference. But that does not mean we're not going to see positive cases with people who are vaccinated and boosted. I want to be real clear on that. But the issue is the severity. The people who are unvaccinated are far more likely, if they contract Omicron, to end up right here in this hospital. That's what we don't want to see. These overworked, exhausted healthcare workers do not want to see that either. So we can protect, and yes, there is a correlation right now between not just I would say look at more than cases, look at hospitalizations. Look at the hospitalization rate. Those are the numbers that are causing greatest concern to me, to be working tirelessly to make sure we have the capacity to handle everybody who's sick, but they don't have to be sick. There's still plenty of time to get the vaccine, if you've been vaccinated, get the booster shot. We're making it so available. It's out there. We don't have that shortage that we were all dealing with just less than a year ago when everybody wanted to get it, but they couldn't get it. And then the at-home test kits and testing facilities. All this is part of an overall strategy on how we can get people of the state of New York safe and healthy, but also keep our economy healthy. I don't want to have the little businesses downtown that had a shutter last year, the little restaurants and the pharmacies and the little shops that I've always visited. I don't want them hurt again. Their owners work so hard. And if all we do is wear a mask when we go in there, or vaccinated, they have a vaccination requirement, we follow that, we'll be all doing our part to make sure not just that we're healthy, but our little small towns are healthy as well. And that's something I feel we should all feel responsible for. So thank you, everybody. I do have to get on the road, but I do appreciate you coming out today.
Have you changed your holiday plans because of concern over COVID?
My holiday plans?
Yes.
I am not flying to Florida to see my dad, that's for sure. I wasn't sure if I would in the first place, and as this started, once Omicron hit, I said to our family, I'm staying in Albany. I'll be managing this throughout the weekend, so that has changed. It's not a fear of flying it, it's just I need to be in Albany to manage this crisis, and so I will not be having any holiday plans, maybe a dinner with my husband. All right, thank you.
Bills leagues, Governor? Those fans want to know, the end of the year has been mentioned as a benchmark. Where are we at on the Bills leagues?
We have had conversations, and I've made it clear to the Buffalo Bills organization that we wanted to accommodate both options and let them see the cost of downtown and Orchard Park, but not putting our finger on the scale. And if their desire is Orchard Park, it's Orchard Park. We've never said otherwise. And we've had many conversations. I've also offered 2 timelines to them, whatever works best for them. I can get this done by the end of this year. I can get this done. We can work out the numbers. We're having good conversations. Or I also have until the end of March, because it is a budgetary item, so I also have a larger window if we need more time. So it's not a hard deadline, but my desire is, I'm a Buffalo Bills fan. Let's lock this down. Let's get it done. So we are very intently focused on keeping the Bills here. If Orchard Park's their first choice, their only choice, it's Orchard Park, and we'll make it all happen. So we're very excited about announcing a deal, hopefully in the near future, but a lot of devil in the details. Thank you, everybody.